welcome back to my YouTube channel. If you're new here, my name is Krista. I'm an international mama of two, dental hygienist turned midwifery student. And here on my channel, I'm gonna be talking about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hey guys, welcome back. It's great to see you. This week, week 4 at Birth and Bloom, we are going to be doing a part 2 to breastfeeding basics. So if you watched last week's video, I talked to you all about breast changes that you would experience during pregnancy, kind of what to expect during the initial latch of getting baby on the breast and starting our breastfeeding journey. So today, because there is so much to talk about, I wanted to do a part 2 to kind of go into things a little bit further, talk to you about more of what the early days of breastfeeding can look like and as that transitions to when you become more comfortable, and talk a little bit about risks, well, not really risks, but some of the complications that can occur when breastfeeding and the benefits to you and the benefits to baby. So without further ado, let's get into it. So I want to set the scene. Say you had a hospital birth and you're getting ready to go back home and you're like, holy cow, I am about to take this little creature home. I have to now take care of them and myself and heal from birth. And it's gonna feel like a lot. So here's baby. Oh, we are so happy that they are in our arms, they are in the world. But now things get real. Let's be honest. Going through the pregnancy and birth experience is very intense. And if you are a breastfeeding mother, not only are you focusing on your healing journey, dealing with sleep deprivation, all of those physical things, you're now thinking about, okay, what is it going to be like to now nourish my baby? So when we're pregnant, we kind of do it automatically, right? So we're eating, we're taking care of ourselves, baby's getting everything they need through us, through our placenta, getting all of their nutrients. Well, think of breastfeeding as a continuation of pregnancy. So the natural design of pregnancy, birth, and breastfeeding is that it's a continual continuation, so to speak. So going from pregnancy to birth and breastfeeding, that is nature's design, right? So now that baby is on the outside of the world, we can't be as mindless when it comes to nourishing baby. We have to be, prepared to what the breastfeeding journey looks like. And to be real, the breastfeeding journey can be extremely demanding and tiresome, but on the flip side of that, it is extremely rewarding. It becomes very easy and simple, but I know that's easy to say now, for me, years of experience at this point, but I do really vividly remember what it was like in the beginning with my first daughter. And, just having fears that she's not getting enough. I'm really freaking tired. My nipples hurt. Is her poop normal? Those things all are going to cross your mind as a new mom. And I'm here for you to support you and remind you that yes, these things are normal, but it's important to educate yourself about what to expect. That way you're not up at 3 a.m, panicked that something has gone awry. Okay, so let's pretend you just got home from the hospital. What are things gonna look like? Okay, so hungry little baby. Some babies are a bit sleepier after birth. Others are really hungry and ready to start eating right away. So generally speaking, newborn babies are gonna eat about every 2 to 3 hours. Okay, so in an ideal world, maybe that works for women, maybe it doesn't. I think with my first baby, I really did like to watch the clock. I had an app that told me when I had fed her last, which breast I had left off on, and that's helpful, but also it's really important to watch your baby's hunger cues and not work off of the clock. Yes, I think it's good to have an idea of when the last time you fed baby and which breast you left off on, but I think it's mostly important to pay attention to your baby's hunger cues and feed on demand. So that is the general consensus of what's best for you and baby, is to feed on demand. So what does that mean? Feeding on demand can be a lot. babies can do something called cluster feeding, where they just seem to want to be on the boob all the time. And you know what? That's okay. It's normal. Get used to it and it will pass. This is not going to be this like constant all the time, okay? But in the early days, baby can be at the breast very, very often. And you could just feed them and then they are kind of rooting around at their hands. Or if dad is holding baby, baby's kind of rooting at the bicep. Like those are all sure signs that baby wants to be at the breast. So though the 2 to 3 hour range is a nice thing to work off of, once again, follow your baby's hunger cues. Are they kind of eating at their hand? Are they rooting around at non-breast objects? And a late hunger cue is if they're like really agitated and mad. They have closed fists. They're then crying and screaming. So avoiding those extreme hunger cues is ideal. So when in doubt, I say pop baby on and go from there. So let's talk a little bit about how you know baby has gotten enough to eat. So I said expect to be, kind of just at the baby's whim of how often baby wants to be feeding. They want to be comforted. They want to be skin to skin. You are all that they know. So keep that in mind. Having baby close to you at all times is really just going to be so important and help baby transition to the outside world. So I want to say, after baby has nursed, how do we know baby has gotten enough? Generally, some babies tend to get very sleepy at the breast. So in the opposite side of that, sometimes moms have to kind of strip baby down to the diaper, give them a little tickle, and kind of agitate them a little bit to encourage that nursing. But generally, after baby is done breastfeeding, they might go from really closed fists to nice relaxed hands. They kind of pop off the boob. They're looking milk drunk. Those are things that you can look for, that they're looking very content after they have nursed. If they're still rooting around, that might be an indication, one, that they're not done feeding, but there might be a little bit more going on, that they may not be transferring enough milk. So nice relaxed hands, baby's looking happy, baby's looking sleepy, baby's looking content, baby's looking milk drunk. A milk drunk is a wonderful, wonderful thing that you've all seen videos and pictures of babies that are just like they've just received the best thing ever. So that is what we want, babies to look very content and tummies are full. I'm going to refer back to some of my midwifery homework when I had my breastfeeding class. But another good indication of knowing that baby has received enough is that they're going to have lots of full saturated pee diapers. That's showing that they're getting enough liquid and fluid from your breast milk. And they're going to have a few poops. So babies vary, especially breastfed babies, as far as how many poops they're going to have, what's normal for them. My first daughter, poor girl, she doesn't need the world knowing this, but for her as a newborn, she was pooping a lot. My mom always referred to her as a tube. She was eating, pooping, had a lot of bowel movements and lots of pee diapers that were nice and saturated. So that's a great indicator that they are consuming enough. My second daughter, on the other hand, there was never concern about her not getting enough milk. She definitely did. I had a crazy milk supply. But she would not poop as often. So there's definitely a variation of normal between baby to baby. Generally speaking, for all humans, at least one bowel movement a day is a good indicator that baby's getting enough and things are going well and smooth. Okay, so when you're breastfeeding, I highly encourage you to have stations around your house of where you're going to be feeding baby and having a bit of like a snack and hydration station. So it is important to know that you are going to be very hungry when breastfeeding, especially in those early days. I was shocked about how hungry I was in the beginning. It's like you think you're hungry during pregnancy, but boy, oh boy, are you hungry when you're breastfeeding. So when your milk is initially coming in around day 3, you will probably notice yourself being ravenous. Like you cannot get enough food in your body fast enough. So that's normal. Your body has to consume extra calories to produce that breast milk. So generally, I think about 400 to 500 calories are what's required to produce enough breast milk for baby. varies from source to source of what you're reading, but you have to consume a significant amount of calories to support the production of breast milk to feed your baby. So do not be surprised if you're feeling very hungry. So say you have one little spot that you're gonna be feeding baby at night, it's super helpful to have a little cart or a basket with your favorite go-to snacks, things that can be left out, trail mix, protein bars. Some people do little like smoothie packs in the freezer that are really quick, easy, nourishing foods that are gonna be on the go, so to speak, to get yourself fed very quickly. Also having giant cups, a giant Stanley, giant water bottles. A lot of people love like the water cups that they get from the hospital. Having water cups filled all around your house is also going to be very, very important. So with the process of milk production, most women can produce more than enough milk for their baby. What is important is that you are adequately nourished, well fed, getting all the things that you need, and plenty of hydration. So good, adequate nourishment and hydration is going to supply your body with what it needs to make breast milk for your baby. It is actually pretty rare to not be able to have adequate milk supply. This might be controversial, but hear me out. There's something called insufficient glandular tissue, and like we talked about in the first video, our breasts grow these mammary gland clusters. They look like little grapes. So in some women that experience low milk supply, it might be a glandular tissue problem where they truly don't have enough tissue to produce enough milk to supply baby. But that is rare, and in most cases, if a woman is experiencing low supply, it could be a nourishment issue, it could be a latch issue. So there are other things to go into that, okay? But the true glandular tissue issue, not meaning to rhyme, is fairly rare, okay? So don't get overly concerned about that. And especially if you're working with your midwife, doctor, or lactation consultant before baby comes, that is something that can be picked up prior to the actual lactation process, okay? So snack trays, giant water bottles all over the house. These are all things that are to, one, remind you, okay, I need to eat, I need to drink, and that is going to give you the fuel that you need to produce all of that amazing breast milk. Okay, so initially after the baby is born, I discussed in the last video that there is a big hormonal shift. The two main hormones that are responsible to producing and synthesizing milk are going to be your oxytocin and prolactin. So oxytocin is the hormone responsible for the letdown reflex. You may have heard about the letdown reflex. So the letdown is what's going to allow the milk. You have a signal in your brain. It's going to allow the milk to flow through your breasts and into baby. And during a breastfeeding session, it is not uncommon to have multiple letdowns. And with that oxytocin flow, that's what's giving you the that relaxed feeling, that you feel like a sigh of relief. And it honestly just, it's the love hormone, right? It's the bonding hormone. So when baby's at the breast and you're experiencing that flow of oxytocin, you are going to feel really calm and relaxed, and you'll feel pretty warm and fuzzy and good and a little bit sleepy. So that is what's responsible for that sensation. The prolactin is what's going to obviously be making the milk. So these are two very crucial hormones that are going to be at play when making milk for baby. Okay, so when you're feeding baby at 3 a.m. and you are exhausted, but then you pop baby on the breast, the oxytocin starts flowing. Honestly, it makes it feel a little more bearable to be up all night because you're feeling that love hormone flowing, and it's just nature's design to make you adore baby and be willing to be up a lot in those early days. And to be honest, with my 14.5-month-old, she is going through a massive growth spurt and or leap and or teething. And I have to remind myself of this because my baby is up a lot. She's breastfeeding a lot. And it can be really hard, guys. It can be very lonely in those wee hours, especially if your husband or your partner is still sleeping and you're up with baby. And this is very common for breastfeeding moms. So It's not uncommon that partner is going back to work. They are not up with the baby like you are. And when you're breastfeeding, that is kind of one of the trade-offs, is that you are up with the baby mostly. You know, when my first daughter was born, I think my husband woke up the first like 2-ish nights. And by choice, I told him, like, this is not necessary for you to be up. Just to be up, I'd rather you be well rested so you can really pull your weight during the day. When I can rest, take naps, that kind of thing. So that's something to be aware of. Okay. So now let's talk about some of the complications that can come up when breastfeeding. Hopefully none of this occurs for you. However, there are certain things that can happen that maybe throw a little wrench in it, but it's just important to be aware of what can go on when breastfeeding, to know what's normal, what's not normal, and what to do if these things are occurring. So like I said, having a proper latch is going to be one of the most key components to having a positive, successful breastfeeding experience. If you are concerned at all about baby extracting the required milk, or if latch doesn't feel very comfortable to you, I highly recommend seeing a lactation consultant. An IBCLC is who I would recommend seeing. That's an internationally board certified lactation consultant. They can work with you in person or online to make sure baby's getting a proper latch, make sure our positioning is proper, to effectively make sure that baby is getting everything that they need and it's comfortable to you. So something that is commonly talked about nowadays are tongue ties or other oral anomalies or different restrictions in the mouth. So once again, this is where my two worlds collide. As a dental hygienist, this is something I'm very aware of, and I've seen lip and tongue ties throughout my whole career. So why is this important to identify, and what can happen if your baby has a tongue tie, for example? So generally, when you have a newborn exam and in the first visits with your pediatrician, they will have a gloved finger that kind of goes in baby's mouth, and to see how the latch is, to make sure that the tongue is suctioning and curling around the finger properly and is showing us that there's going to be an effective latch. So a tongue or a lip tie is when the frenum of the mouth is too tight. What is a frenum? I'm going to show you. A frenum is the tissue of the lip and the tongue, and there's others in the mouth, that if it is attached too high or too low, it can prevent the proper latch to happen, and just not the mouth will not function as it should. So a frenum on the lip, so you can't really see. However, I don't have a lip tie, but if you had a lip tie, the frenum under the lip there is going to attach lower to the teeth. They don't have teeth, okay, but it's going to attach lower onto the ridge of the gum tissue, and you won't be able to freely kind of pass your finger up underneath there. Lip ties generally are not as much of a concern. Both of my girls have a low frenum attachment on their lip, but it did not negatively impact their breastfeeding or their latch. But I just wanted to preface what a lip tie was. And I highly encourage you to do a little bit of your own research, look at different images of what true lip and tongue ties are, and don't think that any tissue there is a tie. It's not. Normal frenum are in everyone's mouth. It just varies from person to person, baby to baby, if this frenum is attached too low or too high. So for the tongue, same thing. We have frenum under our tongue. It's the band of tissue right in the center there. In a tongue-tied baby, the frenum is going to come farther up on the bottom of the tongue, and they're not going to be able to stick their tongue out. It kind of may curl a little bit. It looks restricted. So in a case like that, if the baby has a severe tongue tie and cannot properly move milk, that's when a tongue tie release would be indicated, or a frenectomy. So a frenectomy is a procedure that's usually done by a pediatric dentist. And today, most of the time, they will use a laser and kind of snip the frenum to help release the tongue. And then the tongue is going to better be able to kind of cup around the nipple and the areola to help extract and remove the milk from the breast. So I I don't think if you're detecting a lip or a tongue tie that's something that needs to be addressed and corrected immediately. I think there are babies that can successfully breastfeed with these oral restrictions. However, in some cases, it is best when it's treated to help baby move milk easier and allow the latch to be more comfortable for you. So that's oral restrictions, lip ties, tongue ties. And generally, it should be detected early on. A lactation consultant can check this out. Pediatricians can check it out, midwife. And you, mom, to pay attention to baby's mouth, okay? So other things that kind of correspond to if baby has a poor latch would be traumatized nipples, cracked nipples, blistered nipples. Doesn't sound fun, right? Well, it's not. It hurts. So if baby has a poor latch, your nipple can get a bit pinched. It can cause cracking. It can cause some blisters, bleeding. Not fun. So what do we do about these traumatized nipples? Well, correcting the latch, number one. Some women like to use these little silver cups. They're called silverettes. Silver is great for antimicrobial properties. It's going to help soothe the nipple. It's like completely pure sterling silver that's going to really be meant to help soothe the nipple. Other people use different nipple balms. Those are options for you. It's not something I would jump to immediately because you do have to consider what is in that balm that your baby is going to ingest. So choose wisely when looking at different nipple balms or ointments. And I will say that using a nipple balm and a silverette are not recommended to use together because the silverette should really just be on bare nipple. You can express a little bit of breast milk too and then put it on because breast milk itself has healing properties that are going to help with the soreness and cracked and trauma that you're experiencing. But biggest thing is correct the latch and the nipples will heal and it won't be painful and it'll be a lot more comfortable. Yes. Okay. So another issue can be blocked milk ducts or plugged ducts, clogged ducts. You'll hear all the things about milk ducts. So what can happen here is that if there's pressure that builds up in the breast, say baby got a longer stretch at night, you may have a red spot on your breast that's really sore. It feels a bit harder. That's usually an indication of a blocked milk duct. So generally speaking, with blocked milk ducts, it might be uncomfortable, it might be sore. The recommendations have really shifted when talking about blocked ducts and mastitis, and I highly recommend you finding a lactation consultant once again to give you proper guidance. But generally with blocked ducts, it's recommended to not over pump, not over nurse, but essentially nurse baby like normal. Use either, a cold compress. I like to use like frozen peas. Treat it like almost a sprained ankle. So if you have an inflammation anywhere in the body, think of ice being really helpful here. So we're using an ice pack is going to help kind of reduce the inflammation because it's more of an inflammatory response to that increased pressure from the milk than anything else. So using some ice, you can use some very, very, very gentle massage. People used to think digging at the breast tissue was the solution, and it is not. That can actually cause more trauma to the breast tissue and do more harm than good. So very, very gentle massage, breastfeeding on that breast like normal, using some ice. And if you need a little bit of medication, ibuprofen or Tylenol can help reduce the pain and help reduce the inflammation. Generally, blocked ducts are going to relieve themselves on their own. So what happens if the blocked ducts don't clear up on their own? Well, unfortunately, something called mastitis can occur, and mastitis is not fun, okay? This is not to scare you, but mastitis can really set on quickly and make you feel like complete garbage. Okay, so mastitis can be from it's more of like a bacterial infection, but also it's an inflammatory response to a lot of pressure inside of the breast. So I had mastitis with my second daughter when she was about 2 months, and it occurred because she had a really nice long stretch of sleep at night, and I went about like 9 hours not breastfeeding on my left breast. And she did wake at some point, but for whatever reason, I chose to just nurse on one side and I didn't keep it even. So my left breast had not had any pressure relieved in 9+ hours. So initially it started to get red, it started to get tender, and I was like, uh-oh, this isn't looking great, doesn't feel great. When you know that it's shifted from blocked or clogged ducts to mastitis is when you start to have an onset of flu-like symptoms. Feverish, chills, full body aches. It's not pretty. Like, none of this is fun. So mastitis can come on really quickly. It can knock you out, make you feel like complete garbage. Okay, but you can do the same thing as with blocked ducts. Use ice, nurse baby like normal, making sure that there is a still flow of milk without overstimulating that breast. You can gently kind of feel like you need to massage, maybe not. People are going back and forth of what is indicated there, but generally it seems to be that the recommendation is to not aggressively dig out any blocked ducts, to not add more inflammation to an area that's already inflamed, okay? So what happens if you've done the things, you've used ice, you've used ibuprofen, and you still feel like crap? Well, that's sometimes when a recommendation would be to take a antibiotic. And that used to be more of the old school thing, is like someone has mastitis, they get recommended an antibiotic right away, but that has shifted and it's not like the first course of action. However, that being said, in some cases that become more of a severe mastitis, a antibiotic is recommended. So those are some of the main complications that can happen with breastfeeding. I want to talk briefly on benefits to baby, benefits to mama. So it's no doubt that breast milk is incredible. It is going to change with your baby's needs. There's a phenomena where there's basically receptors in your nipple and receptors from baby saliva that are communicating from baby to you and your brain of what baby needs. So maybe your body is picking up that there's some pathogens present on baby's skin. Your body knows what to do with the milk and give more antibodies to help prevent illness in baby. The balance of fat and protein and all the amazing, incredible immune cells that are in breast milk are constantly changing and communicating with the baby. So that is amazing. Babies that breastfeed tend to have less illnesses. They tend to have less of a risk with diabetes when they're older. There's amazing benefits to baby. If you think about it, let's go back to nature. The baby's perfect food is breast milk. I always think back to how nature's design was intended. And of course, there are cases where a mother may choose to formula feed, or she may feel like that's the best option for her and her baby. That's wonderful. We thank God that that is an option, so baby is fed. But that being said, breast milk is the perfect design for baby's tummy. It changes over time as your baby gets older. And like I said prior, the milk is going to change from that colostrum to liquid gold. Think of it as baby's first immunization, first really nutrient-dense, power-packed liquid gold, tiny amounts, but it is an incredible nourishment for baby. That milk then transitions to the transitional milk, and then eventually into mature milk. So it changes with baby's needs, and it's going to be really, it's just really incredible. Women that pump can see the different consistencies and ratios of their milk. Milk that looks a little bit fattier, milk that looks less fat, milk that may change colors based on if mom is sick. So it's pretty amazing. Okay, and benefits to mom. There are amazing benefits to your mother. So there's reduced risk of breast cancer and ovarian cancer. It's going to help with contracting the uterus back down to size after the baby is born. There is something called afterbirth pains, which tend to be more painful as you've had more babies. So essentially your uterus grows like 400 times its size with birth. or with pregnancy and birth, and then it has to shrink back down to size to about the size of your fist or the size of a pear. So when we're breastfeeding, because of that flow of oxytocin, the same key hormone in labor, it's going to start to shrink baby or your uterus back down to size. So that's really helpful. It can be uncomfortable. The first few days after birth can be really uncomfortable as far as feeling those uterine contractions, but it's really serving a wonderful purpose that it's helping your body heal, helping your body shrink the uterus back down to size. Okay, another benefit is obviously we're not paying for an additional food source for baby. Yes, you're going to be eating a lot, so this is not all for naught. You have to eat and nourish yourself. But relatively speaking, people say breastfeeding is free. Our time is not free. I, disagree with that statement completely. But in some regards, yes, it's free. You're not having to pay for a formula for baby. But, another massive benefit is that it's on you at all times. So if you're out in the world, you don't have to worry about not having a bottle or whatever. Like, you can pop baby on the breast whenever you need to. It's always going to be available to you. So that's amazing. Okay, guys. So I think that was a good coverage of basically, some of the complications that can occur, the real life struggles. It can be really hard, but it can be so, so beautiful. And I want to encourage you that if you want to breastfeed, it is so worth it. It's important to find your support system. There are so many different groups online. There are breastfeeding support groups. There is the La Leche League where they have different meetups. And I just encourage you to kind of find your tribe. If you want to breastfeed, you absolutely can do it. You need the support and just the encouragement, because in the times in the middle of the night when you're exhausted and you're having some challenges, it is helpful to know that there are women that have been in your shoes and that there's people out there that can support you and encourage you to keep going for as long as you want. So I wish you well. If you have any questions, drop them below, and I'll see you in the next one. Bye-bye.